2021 was a year of change and transition as we continued to adapt our service delivery and ways of working to best support the service users during the COVID-19 pandemic. We've experienced change in leadership as we said goodbye to the former CEO, Dr. Greg Usher. Change has offered us the opportunity to modernise our service provision and refocus our need to tackle health inequalities exposed by the pandemic. As we move forward, we'll continue to change, develop and grow to ensure we provide the vital support to the communities we serve and are rooted in. You're going to see some of the highlights from 2021 demonstrating the diverse range of activities and services Metro delivers and the impact we have made. Our vision is for a world where diversity is celebrated, difference respected and valued, and where optimum health and well-being for all is a collective goal. In order to achieve this vision, we are informed by our 4 core values: innovation, insight, integrity and investment. We provide services across the southeast of England, Essex, Kent, Medway and Surrey, as well as pan-London programmes. We also have several borough-specific services focused in and around South London. None of this would be possible without the hard work and dedication of our team. We have 94 staff and 86 volunteers, including our 9 trustees, who all work tirelessly to deliver our vital services. Metro services are embedded in the community and continue to provide a positive impact. Over the course of the year, we have delivered over 116,000 occasions of service across our 5 domains: sexual and reproductive health, community, mental health and well-being, youth and HIV. Up next is a snapshot of some of the key activities and events from January to December 2021.
But we do ask you not to marginalise our human rights. Put our rights at the heart of the vision.
First opportunity we've had to record our sexual orientation and gender identity since the census began in 1801.
And being part of the LGBT community, I think it's super important that I take part in the census as it helps inform public policy for our local services.
Thank you to Comet Relief, who funded the LGBTQ+ COVID-19 fund. We were able to fund 80 groups across the UK to provide relief and recovery services aimed at LGBTQ+ communities.
You've seen some of the highlights from across the charity last year, and as we move forward into 2022, we have the following priorities.
In the sexual and reproductive health domain, our priorities for the year ahead are to diversify our sexual health offering, scaling up the use of digital tools and innovative delivery models to expand access to sexual health education and services. Also, we want to increase the visibility of our sexual health services, ensuring that the Metro brand is synonymous with leading sexual health provision. Finally, we want to provide young people with a holistic package of services to improve sexual health, improving referral pathways and integration between our delivery domains.
In the community domain, our priorities for the year ahead are to gain funding to support the disabled community of Greenwich, particularly around ensuring their voices are heard within the council and the NHS. We also want to improve the way Metro Gavs supports the voluntary sector so that the voices of Greenwich's diverse communities are heard and acted upon across a range of areas, for example health, community safety, environment and cohesion.
In the mental health and wellbeing domain, our priorities for the year ahead are to grow and seek further funding for the LGBTQ+ children and young people's mental health and counselling services. We also want to support our existing service users to access better generic care, such as more people with mental health issues being able to access further support. Finally, we want to grow our Young Greenwich parenting support services to support more parents and families from a range of different communities.
In the youth domain, our priorities for the year ahead are to increase youth voice and engagement. This will be done through the exciting youth social action project My London and the establishment of Metro's Youth Advisory Panel. We also want to increase our physical and outdoor activity offer as we emerge from COVID. This will include a balancing project with Young London, further utilising the Metro Orchard space and an upcoming partnerships around woodland skills and appreciation. We will also continue to improve our offer around life skills, including financial literacy for our young people. Finally, we aim to expand our work around reducing harmful sexual behaviours and providing support to schools in the wake of the well-documented Everyone's Invited movement.
In the HIV domain, our priorities for the year ahead are to consolidate and grow our HIV prevention programmes. This is particularly in light of new technologies such as PrEP and targeting those that find it harder to access PrEP. We also want to support people living with HIV from Latin American communities in a new programme tackling HIV self-stigma. And finally, we want to provide people living with HIV, particularly from families and children who live in poverty, better access to advice and advocacy support, and this will help them to live well with HIV.
We also have priorities across our core areas: human resources and volunteering, finance and premises. Communications, policy and research, enterprise and fundraising, and governance. Metro continues to remain in a stable financial position as we emerge from the COVID-19 pandemic with a projected income of over $5 million for the financial year 2022. There was growth in our community domain as we delivered our 2 grants programs, the National Comic Relief LGBTQ+ COVID-19 Fund and the Greenwich Emergency COVID-19 Fund. Expenditure across our 5 domains remained relatively consistent. In total, our expenditure was less than our income, which resulted in a surplus of over £51,000. This aligns with our trustees' plans to continue to maintain reserves of 3 to 6 months of operating expenditure. We'd like to thank our individual and corporate supporters, funders and commissioners. Without this support, we would not be able to provide our vital services.